A very warm good afternoon to all of you. I'm Dr. SHAZIA from Sharp Eye Hospital, Srinagar. We will be presenting instruction course on cornerstones of a successful private practice. As Dr. Kamal sir has very clearly told that why is it very essential in our current day practice and why we didn't learn about it when we were studying medicine and why do we need to know about it in present times. So my topic is human resource and team building. They say Rome was not built in a day, so were not good teams. Team building takes effort, consistency, and coming together. In this presentation, I'll be talking about mainly importance of human resources and team building, techniques to build strong teams, and what are the barriers that we all face while we are building strong teams. So what is human resources and why is it important in healthcare? When I was studying medicine, I didn't know about human resources and team building because these concepts were very forthcoming to the people who were in non-medical field. But for the medical people, human resources, team building, these concepts came later so. So what is human resource in healthcare? There are different clinical and non-clinical staff which is responsible for public and individual health intervention. Proper management of human resources is used for improving the efficiency and performance of your healthcare teams. Cohesive teams enable human resources to do their best work while achieving the organization's common objective. Why is it important in healthcare? Research shows that teamwork in healthcare is essential to improve A, patient outcome, prevent medical errors, improve efficiency, and increase patient satisfaction. Working in effective teams also increases professional satisfaction in clinical and non-clinical staff and provides crucial peer support. Team building is the process of gathering the right people together and getting them together to achieve your common objective. What are the steps that we take to team building and what are the goals we have? The three basic steps in team building are, first and foremost, define the goals to your team. Define an ideal team culture and then identify result-oriented activities to build trust among your team members. Building trust among your team members is of utmost importance because a team that trusts each other performs better. Engage in team building. Build process and use team development activities to create psychological safety for clinical and non-clinical members and establish an environment that encourages collaboration with open communication. It is of utmost importance to have an open communication channel with your clinical and non-clinical team members because research has shown that communication gap leads to around 70% of medical negligence errors. That's a huge number to ponder upon. Demonstrate leadership. This is of utmost importance and I'll be discussing it later. Define goals of your team. What are few questions that you need to ask yourself as a team leader if you're leading a team, if you're building a team? What are the questions that you need to ask yourself before you do so? Who are the clinical and non-clinical team members? Who are your team leaders? Who are your team liaison members? And what exactly are their roles? What is the reason that your team exists? What are the common goals you're trying to achieve in your team? What healthcare results are you expecting? What norms guide how the team will work? And what are the tangible next steps to be followed? While we all do need the best and the brightest on our team, but remember the best and the brightest minds will only function once they are ready to work together. So however best your team is, unless and until they do not have trust, unless and until they do not want to move forward together, you might not get the desired result that you are looking at. So how do you document your goals on a team charter? What is a team charter? Team charter is a written document that basically defines your team's missions, your goals, what are the scopes of your operations, what is the time frame in which you want to achieve a particular goal. So to give an example about written norm, team leadership has to be very strong. The leader has to control the process. He should know how the things are going, what are the common problems that are happening, and very importantly, the leader should know how to listen. Before you want to be understood, it is very important that you understand the person who's there in your team. And keep a communication channel open. As I said, that non-communication leads to medical errors, especially in the practice that we are having. Have regular meetings with your team members. In our hospital, we have recently started a concept of having morning huddles. So basically what we do is all the core members, all the staff members, they are called to a meeting room. We have a cup of tea and we discuss our daily objectives. So we do not give them monthly goals or yearly goals. This is day on day. Like today, we should achieve this thing. So all team members get together, like how sportsmen, they huddle, we huddle in the morning, and we are seeing drastic changes in the work culture. The team gets pep talk in the morning, and then we achieve day-on-day goals, and it helps us to achieve things better. Also, time management. If you have given your team something to be done, then you make sure that it is done within the team. So, how does the team develop? There are basically some 5 stages that are there in team building. The first is forming. Forming stage is where you are still strangers, where the team members are still strangers to each other. They acquaint and establish ground rules. In the brainstorming session, what happens is members start to communicate, but still they feel hostile to each other. They might be even hostile to leadership. In norming stage, people feel part of the team and that they realize that they can achieve their goals better if they work as a team. Then comes the performing stage, where the team works in an open and trusting atmosphere, where flexibility is the key and hierarchy is of little importance. And lastly, the adjourning phase, where the team conducts an assessment of the year and implements a plan for transitioning roles. Now, true leadership is not willing authority, but enabling and empowering others. One of the tests of leadership is to recognize a problem before it becomes an emergency. It isn't about being great, it's about enabling others to be great. So it is very important that if you are leading a team, that you become the team that you want to be. A leader is as good as his or her team, and a team is as good as his or her leader. So what are the steps that you can take as a leader? Make yourself approachable. This is very important. If the team members feel intimidated by you, if they do not approach you if there is any problem, then that might lead to further failures. Invite everyone into the conversation and establish shared goals. Create clarity on roles and responsibilities of each clinical and non-clinical team member. Make everyone feel important, even your security guard, even your ambulance driver. If the driver knows that how important he is to the team, how important it is to get your patients on time to the hospital, if he recognizes his role and if he feels acknowledged, then that is how things move. You do not have to just acknowledge your doctors or your core team members, but everyone present in your team. Create psychological safety in your team and encourage constructive feedback and open communication that promotes well-being. If you want to give feedback, negative feedback to someone, try to make it personal and try to do it calmly. If you want to praise someone, try to do it in public. Meet your team to jointly establish team norms and team charter with goals and objectives. Discuss and agree on timetable for major activities. Understand what motivates your team and how you can empower them. Just to demonstrate what a good leadership can look like in healthcare, I want to give you a situation. A brain surgeon was about to perform a difficult procedure on a high-risk patient. Several of surgical team members had just met for the first time. The surgeon walks into the room and announces, "Good morning, team. This is a difficult case, and I am a human just like you. Please speak up if you see me doing any mistakes or if you have any suggestions to help." She then goes around the room and introduces herself personally to everyone by her first name. So what has the surgeon done here differently, and why has it made the difference? She has broken the ice. By introducing herself encouraging participation and valuing everyone's role, the surgeon has helped create an environment in which team members can participate to their full potential and they can speak up, if necessary, to help the group navigate problems that could emerge, especially in a high-risk surgery. The focus on safety is a powerful reminder of the team's common goals, providing safe, effective care for the patient.
Dr. Shazia, you can slowly start wrapping it up.
So just to cut it short, what are the barriers that we have in team building are if people are ambiguous, they don't know their roles and responsibilities, inadequate recognition, excessive workload, or lack of leadership support. Thank you so much.
I think that one thing which is very, very clear from this particular talk is that to have a delighted patient, you need to have delighted team workers. That is the cornerstone. You cannot have happy patients walk out of your practice if your receptionist is unhappy, your optom is angry, or your OT technician is not up to the mark. So the whole team needs to be in a sync. And for that, that's what Dr. Shazia said. Every day morning, it's a good idea to have a huddle. Huddle means it's not a good idea just walk in with your briefcase and your ophthalmoscope and put it in the corner and tell your optom to send patients to you. No. Reach 15-20 minutes before to your work, if not daily, every alternate day. Before you start the work, exchange some pleasantries with your team. This would include your peons, your nurses, your OT technicians, your optoms. If not all, at least some representatives from that team. Talk about last day's mishaps, good things. This is a very, very good time to appreciate people. Let's say one day before one optom has seen or diagnosed or helped you diagnose very interesting case. Praise that person by name. Have people clap. Always appreciate before you reprimand. Before you pull up a person saying you were wrong here, how about pulling some good things he has done in his field of work or his clinical work with you? So that's a very, very good technique. Second is, a good leader is not one who leads. A good leader is one who empowers people and makes them lead. That is what a leader is. So you cannot be a leader just by doing everything yourself. You have to create micro leaders within your team. That is when your practice will start stabilizing. You will have more happy patients. So you need to identify people in your team who have the potential of being micro leaders. Nurture them, encourage them, and make them have exposure. Promote them. And whenever there is a credit coming your way or the organization, share the credit. But when there is a mistake, own it up. That is a sign of a leader. So when there is a praise coming in, give all the praise to the team. That this is all because of you people, that this patient was happy, that last month we did very well, we did 200 surgeries, 50 surgeries, whatever, thanks to you people. And if there is something wrong, own it up and say, this thing went wrong, I take responsibility as a team leader. That will actually empower people in your team to do the same. And once they